Everyone working in the restaurant and food services sector needs to consider how to prevent the spread of COVID-19 at the workplace. To help stop the spread of COVID-19, identify and control risks in the workplace. COVID-19 can be spread in the restaurant and food services sector in two main ways. Person to person, that is, by people who are in close contact with each other, and by surfaces or objects, that is, when people touch their face with contaminated hands. The key risk factors for COVID-19 transmission include prolonged exposure, for example, spending more time with potentially infected people; close proximity, for example, working close to others; crowded spaces, for example, having more people in a space; closed spaces, for example, indoor spaces with less fresh air. Working indoors is riskier than working outdoors. And forceful exhalation. For example, activities that cause people to breathe more deeply, such as exercise, speaking loudly, and singing. To control potential exposure to COVID-19, employers should implement a variety of measures such as screening, physical distancing and barriers, implementing a proper indoor ventilation, avoid central recirculation where possible, frequent cleaning and disinfection of surfaces, using personal protective equipment, PPE. The hierarchy of controls can help choose the right controls for the workplace. This applies to all workplace hazards, and this can be applied to COVID-19 to some extent. The levels in this hierarchy of controls, in order from most effective to least effective, are elimination, substitution, engineering controls, administrative controls, and PPE. Let us look at each of these controls in more detail. Elimination refers to removing the risk of exposure entirely from the workplace. Substitution refers to replacing a hazardous substance with something less hazardous. For an infectious disease such as COVID-19, substitution cannot be implemented, but there are other ways to apply substitution controls. These include promoting outdoor dining versus indoor dining, promoting takeout and drive-through versus dine-in, using disposable versus reusable cutlery. Engineering controls refer to making physical changes to remove the hazard. To implement such controls, you can install plexiglass barriers to separate workers from customers, remove unnecessary doors that people would have to touch, add floor markings and barriers to manage traffic flow and physical distancing, promote hand washing by providing access to soap and water or to alcohol-based hand sanitizer to everyone. Provide a safe place to dispose of used sanitizing wipes and personal protective equipment. Sanitize the workplace and commonly touched surfaces or areas such as entrances, shared equipment, counters, washrooms, and kitchens. Administrative controls refer to making changes to the ways that people work and interact, using policies, procedures, training, and signage. To establish these, you can establish contactless curbside pickup, create policies to limit the number of people in a space at one time, establish new cleaning and disinfection protocols, provide education and training on proper hand washing techniques, set up a screening process, maintain a safe distance while handling goods and taking payment, minimize or eliminate handling of cash, and eliminate at-the-door payment methods. Assign staff to ensure that customers are maintaining safe physical distances in congested areas such as entrances, exits, and checkouts. Limit the number of workers by staggering work schedules. Consider job rotation. Reschedule any unnecessary visits to the workplace by supply chain partners, vendors, or others. Employers must ensure that health and safety policies are updated and posted for all to see. These policies should cover how the workplace will operate, including, but not limited to, the sanitization of the workplace, how workers report illnesses, how to ensure physical distancing, how work will be scheduled, and screening measures. Personal protective equipment controls refers to equipment and clothing worn by anyone at the workplace to minimize exposure to hazards and to prevent illnesses and infection. PPE protects the wearer and includes surgical or procedure masks and eye protection. Correct use of PPE can help prevent some exposures, but it should not take the place of other control measures. For example, screening, hand hygiene, use of barriers, and physical distancing where possible. PPE must be used alongside other control measures already in place. When workers perform tasks that require them to work within 2 meters of another person without a barrier, for example, plexiglass, a partition, or a wall, PPE will be needed. For COVID-19, it is recommended to wear a mask at all times. As an employer, you need to follow the guidelines and the requirements set out by the Occupational Health and Safety Act. Let's look at these requirements. Under the Occupational Health and Safety Act, as an employer, it is your responsibility to take every precaution reasonable in the circumstances to protect a worker. By law, all businesses that are operating must have a written safety plan. The plan must be available to anyone who asks to see it and must be posted in a place where it will be easily seen. The safety plan should be discussed and shared with everyone at work, including workers, unions, supervisors, health and safety representatives, or members of Joint Health and Safety Committees, JHSCs, contractors, and suppliers. This will help to ensure that your workers and others understand how you plan to manage the risks of COVID-19. Provide clear information and instruction to your workers. Make sure that they know what they need to do to protect themselves and others. Ensure that they know how to follow your plan's work and hygiene practices, including all new safety measures. Set up or use your current internal communication systems to provide frequent reminders and updates. Use a variety of ways to teach your workers, such as posting notices in common areas, emails, virtual team meetings, and intercom announcements. How to manage a potential case of or suspected exposure to COVID-19 at the workplace. There are steps that you will need to take if one of your workers, visitors, or clients has symptoms that may be related to COVID-19 or is diagnosed with COVID-19. Step 1. Exclude the symptomatic person from the workplace. Step 2. Contact public health. Step 3. Follow public health direction. Self-isolation. If the person has symptoms, had close contact with an individual with symptoms, a confirmed diagnosis, or who has traveled outside of Canada. Return to work after self-isolation. Specific direction for each situation is provided by your local public health unit based on provincial guidance on the management of cases and contacts of COVID-19. Close contacts may include people who have spent time less than 2 meters away from the infected person in the same room, workspace, or area without barriers or protective equipment, and people living in the same home. Step 4. Inform any workers who may have been exposed. Step 5. Report to the Ministry of Labour, Training and Skills Development and to the WSIB. Now let's look at the leave amendments in the Employment Standards Act. Unpaid infectious disease emergency leave. On March 19, 2020, the Employment Standards Act, ESA, was amended to include unpaid infectious disease emergency leave. Employees can take unpaid infectious disease emergency leave if they are not performing the duties of their position because of certain reasons related to COVID-19. Entitlements to the unpaid leave are retroactive to January 25, 2020, and have no end date. Paid infectious disease emergency leave. On April 29, 2021, the Ontario government announced the COVID-19 Worker Income Protection Benefit and amended the ESA to provide up to 3 days of paid infectious disease emergency leave under the ESA for employees who take time off work because of certain reasons related to COVID-19, and an employer reimbursement program. Qualified employees are generally entitled to be paid what they would have earned had they worked and not taken the leave, up to a maximum of $200 per day. Entitlements to the paid leave are retroactive to April 19, 2021, and on September 25, 2021. Eligible employers are entitled to be reimbursed the amount of infectious disease emergency leave pay that they pay to their employees, up to $200 per employee per day taken. Eligible employers must make their application for reimbursement to the Workplace Safety and Insurance Board, WSIB, within 120 days of the date the employer paid the employee. For more information on infectious disease emergency leave, visit ontario.ca/ESA guide. And for more information on the Employer Reimbursement Program, visit ontario.ca/COVID Worker Benefit. For more information on workplace safety, visit the following links. Extension of the COVID-19 period. In response to the COVID-19 pandemic, the Ontario government made a regulation, Ontario Regulation 228/20, that changed certain ESA rules during the COVID-19 period. This regulation has been amended to extend the COVID-19 period to September 25, 2021. During the COVID-19 period, which is March 1, 2020 to September 25, 2021, a non-unionized employee is deemed to be on job-protected infectious disease emergency leave under the ESA anytime their hours of work are temporarily reduced or temporarily eliminated by their employer for reasons related to COVID-19. A non-unionized employee is not considered to be laid off under the ESA if their employer temporarily reduces or temporarily eliminates their hours of work or wages for reasons related to COVID-19. A non-unionized employee is not considered to be constructively dismissed under the ESA if their employer temporarily reduces or temporarily eliminates their hours of work or wages for reasons related to COVID-19. Beginning on September 26, 2021, non-unionized employees will no longer be deemed to be on infectious disease emergency leave. The ESA's regular rules around constructive dismissal will resume. This means a significant reduction or elimination of an employee's hours of work or wages may be considered a constructive dismissal, even if it was done for reasons related to COVID-19. The ESA's regular rules around temporary layoff resume. For practical purposes, a non-unionized employee's temporary layoff clock resets on September 26, 2021. Learn more about these COVID-19 temporary changes to ESA rules at ontario.ca/ESA guide or call the Employment Standards Information Centre toll-free at 1-800-531-5551 or for the hearing impaired, TTY 1-866-567-8893. Information is available in multiple languages. For more information on workplace safety, visit the following links. For help and support, contact the Occupational Health and Safety Contact Center. Call anytime to report critical injuries, fatalities, or work refusals. Call 8:30 a.m. to 5 p.m. Monday to Friday for general inquiries. The toll-free number is 1-877-202-0008. Press 1 to report an accident or work refusal. Press 2 to report a complaint, including COVID-19 concerns. Press 3 if you have questions. Once you have reached a telephone agent, you can ask for service in other languages. In an emergency, always call 911.